Billy Maxwell with Aquacast Liner, and we're going to do an instructional video on how to apply a hip spica cast with both the Aquacast Hipster as well as the Aquacast Rolls. And the first thing you would do is place a belly pad on the chest of the infant, and you would take the appropriate sized hipster. In this case today we're going to use a size 2 on this infant. You would then place the hipster on the legs and pull this up pretty snug. And you want to get up as high as you can. The goal here, what you're going for with the cast material, is about nipple line. That's pretty normal for a spica cast. And you're going to make sure that you pull up the hipster in the back as well. Then we're going to place the child, in this case infant, on the hip spica table. And this will be the position that you will put the cast in. We usually have a doctor or a nurse, resident, somebody else in the room doing this, since it's done up in the operating room. Will hold the legs in the position that they want, whether this is a femur fracture or hip dysplasia, anything like that. Okay. So now we're going to take some of the excess that's laying here and trim this back, being careful not to trim any part of the patient. We're going to take our Aquacast liner. We're going to start right above the malleoli of the ankles. And we're just going to start wrapping around. We're going to make a little cuff about 2 turns. And then we're going to continue with our 50-50 coverage. Straight up, as high as you can. And we're going to go underneath the cast, underneath the, and back up to the top again. Usually you will wrap both legs first before you would wrap the top of the torso. And we're going to do the same thing here with the 50-50 coverage. One of the most important parts of doing this spica is to make sure that your person that is in charge of the position of the legs holds them steady. This is a part of the spica that gets overlooked, and it's one of the most important parts of the spica. We're also going to make some cuffs for the inside edges. We usually take the roll, fold one pillow over on top of it, and take that sticky side with that pillow down, and we're going to go right on the top, right down and back. Another one on the other side, the same way. And what you're going to do with your fiberglass when you roll your fiberglass is you're going to keep your fiberglass off of this edge by leaving on one pillow with your fiberglass top, and I will show you that once we get to that section of the cast. We're going to take some 3-inch rolls and start rolling around the torso. If you have an issue with the hips, you can trim this back a little bit just so it lays a little flat. Same on the other side. There, and you can see the difference if we have a big pucker here. You just want to make sure that you're laying it as flat as you possibly can. And once again, the 50-50 coverage. And we're going to go up to just about nipple line. We're going to take one more of the 3-inch. We're going to make a cuff around the top of the cast. This time we're going to use 2 pillows folded over of the 3-inch roll, and that's going to give us a very nice cuff, a very nice border, so that the fiberglass is not rubbing on their skin, usually underneath the armpits or up top here. So now we're going to make these same type of cuffs for around the ankle as well. And once again, the purpose of these cuffs is to just make sure that you have a nice border between the patient and the fiberglass, just so that there's no rubbing of any kind with the fiberglass. And we're going to do, with the 2-inch, I usually will put one pillow over. If it's 3 or 4-inch rolls, I usually will fold over 2 pillows. We're going to place that right on the edge. And just so you can see, the finishing would look like this. We'll get to that later, but you can see you're right above where the malleoli are. Now, there's also an area in the back of your hip spica that everybody will call a resonance patch, a triangle, resonance triangle. And the way that you can make sure that you have enough coverage on that, because it's very light with any type of a spica, is you're going to take a 4 or a 3-inch, I'm using a 4-inch now, and we're going to create a nice little pillow. Again, we're going to put sticky side on sticky side, leaving a little bit extra on each end, and we're going to go right on greater troche and across the other side to greater troche. Going to take another piece, just a single layer this time, and put another one down there, again, the same area, greater troche to greater troche. And you should be able to feel, and you can tell that you've got everything covered there. The next thing is that you want to use is the saw stop. We usually, on these little babies, we'll use 2 layers of the saw stop because just for cutting purposes, you have a little bit larger surface area to go down. Now when we remove these, we remove down the inside of each leg, the outside of each leg, and then up the sides of the torso. So with the saw stop, I usually fold over my end just to keep it from fraying. And I will put a strip there. And this is going to be covered with your hipster at the end on your last roll of fiberglass, and that's okay because we all know where we're going to cut this spica off. So it's on the cutting lines is where you want this to be. You want to be careful in this area here. Now the facility that I work for, we do not use a bar in between the legs. It's just something that we don't do. We create struts with our fiberglass so that it's strong enough where you don't need a bar. If you do use a bar, you could incorporate that at the end, but today it's going to be a cast that does not have a bar in between the legs. And we're going to put these strips on. Once again, this is just an extra protective layer for the patient with the cast saw getting warm. And we all know that that can happen from time to time. And we're just giving the patient an extra barrier between their skin, the AquaCast liner, and the saw. We do cut a belly hole in the institution that I work for, but we're not going to cut a belly hole out. Sorry, we will not use the saw stop for the belly hole since we have our belly pad in place. That will give us an extra barrier there. So that's what that's going to look like with the AquaCast hipster, the AquaCast rolls, and the saw stop. So now we're going to apply the hip spica with the fiberglass. And we're going to start on one leg, and we're basically going to mimic the exact thing we did with the AquaCast rolls. Now remember that we're going to leave at least 1.5 pillows. I err on the side of caution and leave 1.5 pillows, and we're just going to roll like you normally would with your fiberglass with the 50-50 coverage. And go up and around and lock that in. Work back down this leg here. just like so. We're going to take another 2-inch, and the facility that I work in, we do not use a bar, so we're going to take our fiberglass and we're going to make a couple of splints, about 3 or 4 layers long, about 8 inches in length, and we're going to lay that right on the ischium and come up, leaving a good space with your Aquacast liner. You can see we still left another square, and incorporate this in, and coming up around the torso. And once again, up at the top of the cast, we're going to leave one full pillow of padding. We're going to do a splint on our other side of the leg the same way, about 8 to 10 inches in length, about 4-fold. We're going to lay that one the same way. Catch that on the way around. Make sure that we have enough up at the top. If you do cut a belly hole in your spica cast, you want to make sure you have a very thick band up at the top so that it can withstand and not break down. That's one of the areas. And also down towards the groin. Now you still have your resonance patch in the back, so we will take a 3-inch roll, and we're going to do that fan fold that we're going to go greater troche to greater troche, make it a little bit longer, about 4-fold down. And just like we laid on that extra padding, we're going to go greater troche to greater troche and incorporate this in. And you can tell you have your 3 splints, a splint here, a splint on this side on the patch, and then we're wrapping this around, and you're going to complete this roll up to the top to make sure that you have everything in. From here you will fold back your edges, pull them snug. You're still leaving a padding down at the edges of your cast so that you don't have any chafing issues with your fiberglass. And up at the top, we're going to leave the belly pad in until we cut our belly hole all the way around. And your last Hollywood roll will be 1 layer just to incorporate the edges of your spica. Now if you stay where your struts that you made with your Aquacast, you should not have to trim out any area, maybe on the back side of the bum region. And that, in essence, is your hip spica cast with Aquacast Hipster and Aquacast lining.